HWE 200, Week 5 Journal. Explain the results of your assessment and identify your risk of diabetes. There's no history of diabetes in my family. I do not tire quickly, and I do not always seem to be fatigued. I do urinate frequently, but I take a diuretic for my high blood pressure, and I drink a large amount of water every day. I think I have a pretty average thirst level. I am very far-sighted, so my vision is blurry without my glasses, but it has been that way since I was 4 years old. I am overweight, but I'm working on that. And no, I have not suddenly lost weight. I do not eat excessively. My wounds do not heal slowly. I do admit that my skin is frequently itchy. I answered 3 questions yes. I visit the doctor every 6 months for my hypertension. I have fasting glucose done every 6 months. My A1C is well within normal limits at 4.5. Right now, I do not have an increased risk for diabetes. Explain the relationship between health and wellness for discussing the impact of diabetes on at least 3 dimensions of wellness. I have chosen to highlight the physical, emotional, and social dimensions of wellness. I have seen the profound effect that diabetes can have on the physical dimension of wellness. Diabetes contributes to poor circulation, which can result in decreased blood flow to your feet and legs. Some diabetics end up with ulcers that do not heal and end up losing toes, feet, and even portions of their legs due to decreased circulation. It can cause problems with eyesight also. Diabetic retinopathy is a serious concern. It can result in vision loss, which can have a tremendous effect on your physical wellness. Preserving your vision is also important to your occupational and emotional wellness. Neuropathy also seems to be a common complaint in my patients with diabetes. The numbness, tingling, and pain are very frustrating. Also impacting emotional wellness is simply having a condition that requires you to be meticulous about your diet and medications. It can be tough for a newly diagnosed teen to stay away from the junk food that all of his buddies are eating. Some teens can also be embarrassed that they have to take a break in the action to stop, get out their glucometer, and see if they need to give themselves a bolus or eat a snack, especially if they are involved in an especially fun activity with their friends. I take care of people daily that are socially affected by diabetes. They are non-compliant with their diet or medications and end up with the complications of chronic pancreatitis or kidney failure that requires dialysis. Some are blind and missing limbs, and most reside in nursing homes. Several have no regular visits from friends and family members. They rarely participate in activities at the nursing home, and the only time they seem to get out is when we transport them to dialysis, or their glucose goes too high or too low and the staff calls 911 for EMS care. Identify 3 lifestyle habits a person can practice to reduce his or her risk of type 2 diabetes. I think the 3 lifestyle habits a person should practice to reduce their diabetes risks are daily exercise, healthy eating, and maintaining a healthy weight. According to our text, exercise lowers blood sugar levels by reducing the body's resistance to insulin. This only lasts for 24 hours, so it's important to get some exercise every day. The American Diabetes Association website is a great resource for more information on getting active every day to help prevent type 2 diabetes, and how regular exercise can also be used to help keep diabetes under control after a diagnosis. Healthy eating is another way to reduce your risk of type 2 diabetes. Getting educated about how the human body uses carbohydrates, proteins, and fats is a good place to start. Improving nutrition and making healthier meals does not mean that you can't enjoy your food anymore. You just might be surprised just how delicious the healthy food can taste and how much better you feel after eating realistic portions. Maintaining healthy weight is the 3rd lifestyle habit that will reduce your diabetes risk. Being obese or even overweight is a big risk factor for diabetes. The good news is that getting active and eating healthier will not only reduce your risk of diabetes, but they are also key components in helping you lose the extra weight and get down to a healthier weight. I call that a win-win situation.